All right, we're going to talk briefly about Medicare supplements, Medigap programs. There may be other names out there, but those are the two big ones. But before we get into that, I don't want to make any assumptions, so we're going to briefly speak on Medicare by itself. If you don't know, which you probably do by now, but I'm going to go over this real briefly. Medicare has two different parts, Part A, Part B. Part A is your hospital stay. That is paid for by your deductions that was coming off of your checks when you were employed. There's something in there talking about 40. To qualify, you have to work for 10 years. Regardless of what they're talking about, one way or another, it has to all add up for 10 solid years. 40 quarters, whatever you want to call it, 10 years. That's all it is. When you look at your checks, or where self-employed, you'll be differently because it's actually 2.9% or somewhere about off in there for the bottom line after deductions. But if you're employed, you got to check like most of the people. When you look at your checks, there was a deduction there for half that 2.9 or somewhere around off in there to 1.5 that came out of your check. The other part came out of the employer's check. Or what they paid into it. So both combined came up to 2.9 or somewhere about off in there. That pays for Part A. Okay, that's already done. If you work 10 years in the United States or file taxes for 10 years in the United States, that part's done. That part is qualified. Now you just have to wait for a certain age, which I'm assuming that's what you're coming up on. Part B is a little bit different. Once you sign up for Part A, you will have an option of starting your Part B. The reason it's an option to start your Part B is because they're going to charge you another $100 a month, and premiums, fees, whatever you want to come down to, is coming out of your check or coming out of your bottom line. Most people get a Social Security check or signing up for Social Security checks. When you look at your Social Security check, there'll be another $100 there coming out to pay for Part B. Part A is for hospitals. Part B is for anything outside of the hospital, doctors, offices, that kind of thing. Now, that all brings me back up to Medicare supplements because everybody knows if you've been looking at this for any length of time, there's 20% still left. After you have Part A and Part B, there's 20% left plus medications that you're going to need if the doctor prescribes you some that you're going to go to the pharmacist and get. None of that is covered under Part Medicare. What do I mean by that? Let's say you slip, fell, normal injury, you broke something, a hip, wrist, not a hip, a wrist, finger, whatever. You go into the emergency room, you go into the doctor's office, whatever it may be, that bill may be $2,000. And trust me, I know what you're thinking. You can't get out of a hospital with a bill of $2,000. It's not possible. But let's say the bill came out to $2,000. Just for easy math, that means there's $400 left behind of the 20, which is 20% of $2,400 that you're going to have to pay for. Whoop-de-doo, $400. That's a lot of money for some. For other people, they spend that on a weekend trip or dinner, whatever. Here's what people don't quite understand. That 20% is a baseline. There are still deductibles and co-pays in addition to the 20% that you also have to take care of. Deductibles. Matter of fact, I think one of the numbers that I read recently is that for a hospital stay, deductible for a hospital stay is somewhere around $1,200. That does not apply towards the 20%. It's $1,200 before the 20%, 2080 kicks in. So roughly that same $2,000 visit, let's say it was actually $3,200. Now you're getting the point. The first $1,200 you would have to pay, leaves $2,000 left. On $2,000 that's left, you have $400 additional. So altogether you would have paid $1,600 for that hospital stay. Still not talking about medication or for painkillers or whatever that you have to go get from the pharmacist, which also has to be taken care of out of pocket. Now, all that said and done, let's get into Medicare supplements. I just wanted to have a baseline there, guys, just in case. Medicare supplements, Medigap, same thing, different name, has different programs. It has Plan A, Plan N, Plan C, Plan Fs, all that kind of stuff. The majority of people that are under programs, if they're getting it after the fact or on their own, they typically go with something called a Plan F. Here's a short explanation without dragging this video out any longer than it needs to be. You have different plans that falls under Medicare supplements. All Medicare supplement plans are standardized by the federal government, CMS. Anyway, it's federal. It's by the federal government. It's been mandated to have the same things. In other words, all plan ends are identical nationwide as far as their base coverage. Now, a particular carrier, because it is private insurance, is not federal insurance, is not social medicine. Private insurance companies out there, Blue Cross Blue Shield, Aetna, Humana, Kaiser, United Healthcare, all those guys. They are the one that's issuing these plans. They're mandated by the federal government to have certain benefits in them. Now, if those plans want to offer more benefits, one of the big ones out there right now, which I love, is Silver Sneakers. Silver Sneakers is a health program that you can go into different gyms, different YMCAs at no additional cost to you in most cases, and there are all kinds of other benefits that are out there too. Here's the long and the short of it is, they are standardized. So if you get a Plan F through one company and a Plan F through the other company, the basic coverages for, as far as the government is concerned, are standardized. One may offer you free bubblegum once a month. One may offer you a free movie pass once a month. Guys, they're not going to do that, but just to let you know. They can offer free stuff, but the basics are standardized. The reason most people go with Plan F is because it is the most intensive, well umbrellaed plan you can get. Everything that could possibly go wrong in most circumstances are covered under Plan F, including foreign travel. Once you go below Plan F, all of a sudden you have little foreign travel may not be covered, but everything else is. You may have a deductible every year of $100, $150, whatever it may be. Each plan is different, 20%, but covers everything else. So in other words, that 20% that Medicare pays for that's left over, you can get plans that just cover the deductible part of it. You're still responsible for 20%, but there's no deductibles. There's all kinds of plans out there. You have to look really close at them. But that's what a Medicare supplement plan is. Also, you have Medicare Part A and Part B stays in place, period, no matter what plan you choose. Okay? The supplement program matches up to that, so anything that Plan A and Plan B doesn't cover, the supplement does have an option of covering before you do, so you don't have to. But those are all options based on what your needs are. These plans are nationwide, so they're good in California. If you live in your state, you have to apply for it and accept it in your state because everything is governed through the insurance boards or through the insurance carriers. But once you have that plan in place, it's good anywhere in the country. You can go to Florida, you can go to California, you can go wherever you want to go, and that plan, you can walk into a doctor's office, walk into a hospital, and still get the same service as you would back home. They're universal. That's the reason people like them. But guess what? Because of all that access and freedom, you have copays. I mean, not copays, sorry. That's the wrong word. You have payments, fees, premiums that's associated with it. Premiums is, from 100 to 300 to everything in between. It just depends on what plan, where you live, your zip code, accessibility, that kind of thing. But now, here's the great part about it. There's several of them out there, so you can pick and choose if that's the direction you need to go. In the next video down, also, I'm going to go into why you would choose a Medicare supplement program versus other programs that are out there. But once again, if I don't answer your questions to your satisfaction based on your specific needs, once again, you have the ability to leave me a email with your question, and I will get back with you and try to answer whatever questions you may have. So finish looking at the other videos that's on this page as far as supplements are concerned. Once again, if you listen to all the videos and can't find the answers you're looking for, just drop me a line and I will try to get back with you as soon as I possibly can. Thanks a lot, guys.